Going to do positional releases today. Positional release is an indirect technique basically used to passively shorten the muscle by putting it in its shortest position, a position of greatest comfort, which allows the muscle to fully relax and kind of release any of the tension that is built up. It's really used for any fascial restrictions or spasms, joint hypomobility, anything like that. Not used right before activities. It would just undo everything as soon as you started moving that muscle again. So mainly most helpful after exercise or on their day off or something like that. But basically the goal is to, like I said, release any of the tension. It can decrease swelling, pain, and increase strength of that muscle. Typically you start the treatment, if you're doing more than one muscle, you start proximal and work distal. Okay, so first we're going to do the middle trapezius. So before you start your treatment, you want to assess tender points on each side. So it's right in that middle, basically, of the medial border of the scapula. It's down kind of right where those rhomboids are mainly, because the rhomboids and that middle trap have very similar actions. So we start on the one that is the more tender, so let's say that is her right shoulder, and that's the one I'll start on. Muscle originates from the occipital bone and the spinous processes of C7 through T12, and inserts on the lateral clavicle, acromion process, and then the spine of the scapula. And for the middle trap, the main action of the muscle is retraction of the scapula, so that is the position we're going to put it in for our positional release. So we're going to have patients prone, looking away from us, so not to stress their neck. And then I'm going to come under her shoulder, just keep her relaxed, to lift up the shoulder a little bit, similar like you do for the lower trap release. And then just put a little bit of pressure on the spine of the scapula, putting it in that retracted position. And that is where you're going to feel the middle trap. You're going to hold this position for 90 to 120 seconds. But really the body will tell you when the tension has been released. You're going to feel that muscle fluttering. And oftentimes, if you can't feel that, then the limb will just feel heavier. There it goes. So yes, hold that. Make sure it's all passive. And then when that muscle is done fluttering, we can slowly put them back down. And then, now we are going to do the gluteus medius. First, let's check the tender points just lateral to that PSIS. So not lateral hip. See if either one is more tender than the other. Let's say her left one is, so that's the one we're going to start with. Gluteus medius runs from that lateral surface of the iliac crest down to the greater trochanter, and it abducts and extends the hip, and then depending on the fibers, both internally and externally rotates. So the patient just stay nice and relaxed as we extend and abduct the hip. I'm going to put her thigh on mine. Is that alright on your knee? Mm-hmm. Okay. And then we're going to feel just where that tender point was, lateral to the PSIS. And hold there for 90 to 120 seconds or until the muscle fluttering stops. Let's say it stopped, so we're going to have her stay relaxed back to that starting position. And moving down, we can do the tibialis anterior. So its tender point is right on that lateral lower leg here, near your origin. See if either one is tender. And so tibialis anterior runs from that lateral tibial condyle down around the foot to the plantar surface of the medial cuneiform and the first metatarsal. And its main action is to dorsiflex and invert the ankle. So that is what I'm going to do. First we will relax. Flex the knee, dorsiflex, invert. You can feel, I'm going to wrap my left hand around to that tibialis anterior tendon. And again, hold that position for up to 2 minutes or until the fluttering stops. And if the fluttering seems to stop pretty quick, you can flex the knee a little bit more, more inversion to shorten the muscle even more. And again, relax on the way down. Okay, so now we have our patient in a supine position. So we're first going to do the long head of the biceps. So we're going to check those tender points again, right in that anterior shoulder near the origin of the long head. Let's see if that one's tender. That one is. We'll say her right one is more tender. So the long head of the biceps originates from that supraglenoid tubercle on the scapula and runs down to the radial tuberosity. Main actions: flex the arm at the elbow, a little bit at the shoulder, and then adduct the shoulder as well. So that is the position we're going to put her in. So just relax. There you go. So we're just going to basically go across her face, supporting at her elbow, and then you're feeling for that muscle fluttering near the origin of that anterior shoulder. You can try it in different positions to get that fluttering to start. And again, hold for at least 2 minutes or until the arm feels heavier. I should say it does, so we will put you back down. And then also with patient in the supine position, we are going to do the adductor magnus. Again, let's start just by checking the tender points, right in that medial thigh. Check it both sides. Say this one's more tender, her left leg. So the adductor magnus runs from that inferior pubic ramus down to the adductor tubercle and that linea aspera of the femur. Mainly does flexion and adduction of the hip. So again, that's the position we're going to put the muscle in. So it's in the shortest, most relaxed position. So we can just hook here, make sure she's nice and supported, and then just feel in that medial thigh. You can add a little bit of pressure proximal to the proximal, just to shorten that muscle a little bit more. Feel that fluttering. Again, hold for 90 to 120 seconds. Get a little bit more flexion, adduction, making sure she's nice and relaxed. And then relaxed all the way back down to the starting position. When doing these treatments, to remember to do both the antagonist and the agonist muscle, because if one is released and the other still has tension on it, it's going to just pull that first muscle you released right back into a stretch position, and that's going to undo all the releasing you just did. So we can't just release one muscle, you have to look up the entire kinetic chain. Like I said, not used right before activity. Patient usually, it helps if they heat either before or after the treatment.